You're watching CTOM TV. Knowledge is power.
I always like to ensure that folks feel hopeful because there's so much dismaying news out there in general right now, but especially, for cancer patients so often. Doors feel like they're just constantly closing rather than opening. So the testing that we're talking about is a way to make sure all the possible doors that could open for you are opened. And you know what Alex was saying earlier about, well, we might have a hard time getting an oncologist to go along with something that's an off-label. The reality is we actually are quite successful at that on the advocacy side. So don't be concerned about that. But I wanted you to know that right now in the world, there are over 100,000 clinical trials for cancer. And clinical trials today are very different from what they were a few decades ago because of the advent of this genetic testing. So the short version for you is that I really want you to know is if you go through this process of figuring out exactly what treatments are matched for you and what you need, and there just seems to be a barrier to you accessing them through your public healthcare oncologist. There are many options that you can explore, and one of them includes this 100,000 clinical trials. And in clinical trials these days, for the most part, people don't need to go and attend a facility in order to access clinical trials. You can access and receive the treatment that you need in your hometown, and usually from your current oncologist with just a little bit of paperwork, assuming that you are a fit for the trial. And clinical trials at this time, what that really means is we already know this drug works better than standard care. We're just trying to confirm the dose, and really that's kind of at the point that they're testing it out on you. That's really what they're looking for. So really great benefit that can come from this. And it's as easy as plugging in a little bit of your personal data into an automated system and getting an immediate list of all trials that are relevant to you. So it used to, just even 3 years ago, it used to take us 30 hours just to try to track down all the trials that could be relevant for somebody. Now we can do that for you within 10 minutes. So it might feel overwhelming, but there's great technology and support out there to explore that if that's where your journey takes you. So we were talking about the 4 pillars of precision oncology, the first one being the testing we've just run through. The second one really being, now we've got all this data, how do we make sure we're applying it to you as effectively as possible? And we do that by using essentially this list plus many other elements. Looking at everything that pertains to you specifically, how those mutations are showing up, how they might be influencing each other, how the combined treatments for the different mutations that you might have will work, which to apply when, and then accessing those things. All of that is critically important to you getting the treatment that you need as quickly as possible.
Thank you for watching CTOM TV. Subscribe below and stay informed.